Prior to British intervention, the country had its own approaches to health and well-being. This traditional medicine incorporated themes of community, environment, and spiritual being that were quashed by imposed British systems. The underrepresentation of traditional medicine in the current health system is a result of colonial hegemony. Colonial rule created a dichotomy in approaches to health, traditional versus Western medicine. The power dynamics of colonial rule resulted in a cultural clash that subsequently undermined and stigmatized traditional medicine. Thus, traditional healthcare is marginalized not because it is ineffective or unhelpful, but because the British prioritized their own ideals over Ugandans. In fact, the Western medicine that comprises the entire institutional health system today was created to serve the needs of the West. The British were ethnocentric and self-serving in their colonial endeavors. Having a health system based entirely on Western medicine disregards uniquely Ugandan needs by clinging to the vestiges of British colonialism.
The colonial effort to dismantle traditional medicine can be seen clearly in acts such as the Witchcraft Act of 1957. Through which the UK colonial powers attempted to destabilize the existing system and perceptions of traditional medicine. Although witchcraft is technically defined as threatening to cause harm or disease to any humans or livestock, this does not encompass traditional medicine. However, definitions of traditional medicine and witchcraft remain artificially associated because of deliberate acts such as the Witchcraft Act that force this parallel. This association of witchcraft and traditional medicine have continued long after colonization. In 2009, Christopher Chibanza is quoted saying, "Recently, there have been so many instances of human sacrifice by traditional healers and herbalists." Imperialism dramatically shifted the narrative of traditional medicine towards an association with heinous acts of violence and brutality. Since it was born from colonial perceptions of traditional medicine as useless and even malicious, the current system ignores traditional Ugandan approaches. There is not institutional recognition of traditional medicine. This is harmful to Ugandans since the system, as it currently stands, is deeply flawed. The healthcare system has adopted Western ideas and elements that are ill-suited to Uganda. Namely, it fails to address the logistical challenges posed by Uganda and the holistic vision of health sought by Ugandans.
80% of the population in Uganda relies on traditional medicine. This is in part due to Western-trained medical personnel being limited or not really accepted by the community. Because traditional healers usually live within the same community as their patients, they are easily consulted. Due to their accessibility, patients are more likely to discuss matters more freely and to be more trustful of their treatment plan. Traditional healers and their community members thus form important connections and bonds with one another. Uganda's current healthcare system is incredibly overwhelmed. Hospitals, clinics, and more are severely understaffed. It is estimated that 84.4% of the population in Uganda lives in rural areas, but most of the existing healthcare infrastructure is concentrated in urban areas. But with the help and attention of traditional healers, the healthcare system's current burden of insufficiency can be helped. In Uganda, there is at least one traditional healer for nearly 290 people, compared to one Western-trained medical practitioner for every 10,000 people in urban areas and 50,000 people in the rural areas.
More importantly, Uganda's healthcare system, and the view of health in the world as a whole, has revolved around physiological curing, treating the goal of a healthcare system as merely to eradicate disease. In doing so, it has put in the background the idea of holistic health that incorporates spiritual and psychosocial dimensions of health and illness. Religiosity and spirituality are extremely important aspects of Ugandan society that are intimately intertwined with illness narratives. In Uganda, the conception of health is often not understood as solely individualistic, but rather as community-based. Traditional medicine, unlike biomedicine, allows spiritual health and community health to exist within the context of the health system, ultimately allowing individuals to adequately achieve their personal conception of health.
Given the limitations of the current purely biomedical healthcare system and the ability of traditional medicine to address some of these prominent failings, the institutional system should incorporate traditional Ugandan medicine. Doing so would help realign the healthcare system with the challenges and needs of the Ugandan context, leaving its colonial vestiges behind.